So I'm here on Harley Street with Dr. Bakash, who's a very well-known cosmetic surgeon, and one of the things you're particularly known for is your breast augmentation. And we've just gone past for International Breast Cancer Awareness Day. There's a lot of criticism about breast implants. How safe are they?
Stephen, lovely to talk to you about this topic.
Yeah.
To be honest, I've been doing breast surgery the last 35 years. There are implants coming and going and being criticized. It's like updating the device every time you go, like you're changing your car as we go along and you find some difficulties in changing it. It's still, I would recommend to go ahead and do it. The safety is not bad considering the safetiness of other equipments we use in a daily life. It's not anything more. And the most important thing to looking after. You cannot just have it and completely forget about it. You have to look after it like you're taking your car for service every year.
So like an MOT.
Absolutely.
So,
you need to look after it. If you don't look after it, you cannot say, oh, the implant is lifetime guarantee. I don't see anything. I just sit with it and don't look after
so
it.
how often after having some breast augmentation would you suggest people, a woman comes and gets it checked?
Usually for 18 months, I do proper checkup of very frequently.
Yeah.
2 weeks, 6 weeks, 3 months, and 6 months, and
Yeah.
a year.
Yeah.
And then after that, every year.
Yeah.
It's a must. And in between, if they have any worries about like lumpiness or softness or hardness, pain, or anything like change in shape and size, they should come.
Yeah, absolutely. Now, one of the things forgive me for asking, we know you do a lot of famous people, and some of the Miss Worlds have been here, and a lot of big names have been here. But that's not just the type of women that come here. The women that come here because they sometimes have issues about their breasts and need work done, as opposed to just making them bigger, isn't it?
I agree. There are people, they want to make their mind happy. It's self-esteem and the confidence in themselves and the physics. And that makes an influence on their life, not only in the professional life, in the social life, plus their relationship. This is very important. I have seen people changes radically with the blooming and really a happy face and everything. That cannot be explained until you are in that situation.
Yeah.
So I still strongly recommend they have to go through it. They have it. Implants are not completely sort of...
The reconstruction work you do as well, don't you?
Yes,
Which,
yes,
so
yes.
it's not just a vanity project sometimes.
Absolutely. So there are 3 types of breast work. One is pure vanity product,
Yeah.
mainly for their mental satisfaction. Other one, people want the glamour model, they want to use there for their profession.
Yes, yeah.
And the third one is the reconstruction. They lost due to their cancers and other thing. So it depends upon those. You need to listen to them, individualize the type of operation rather than one thing fits all. It's not the thing.
And one of the amazing things I heard about you, I don't know if it's true or not, apparently a certain glamour girl wanted to go even bigger after you did 2 operations on her, and you said no.
I always say this little slogan,
Yeah.
give squirrel the squirrel breast, not the elephant breast.
Yes.
So this is the most important thing to individualize it. If they go across, I would say no. It is not healthy for your back, neck and shoulders and things. So I would say rather no.
Saying, give the squirrel breasts, not elephant breasts.
So this is very important. They should. This is the analogous. I always say, you are a squirrel, you should have a squirrel breast. Not asking me that.
So the other question is, obviously we're talking about breast cancer awareness. It's something that women are talking about. What advice would you give the average woman who's not going to have any work done by you, but checking her breasts?
Absolutely, because every breast implant ladies, they have it. I always teach them how to check their breasts after their cycle, or if they finish the cycle, at least once a month to check it. If any detection of anything, immediately they have to seek for the investigation like ultrasound and mammogram. And the most vital part, these are the 4 elements. If they have a family history of breast cancers, they have to be very careful. They have to start checking very early.
Yeah.
And second, they should not use contraceptive pills longer time. Anything more than 3 years or 4 years is not good. And then all the coils fitted hormones also not good.
Yeah.
And the fourth important thing, people with obesity, heavy fat, and that's the fat responsible for triggering the cancer as well.
Yeah.
And also stress related. So these are the factors you have to be very careful, and also immune differences.
So how often should a woman go to the doctors to have a check, an average, would you say?
As I said to you, if they have a breast cancer in their family, they should start early, like 30, 40s.
Yeah.
If not, average after 50, they have to do that. That's very important.
But no, the question was how often she should go to the doctors.
Usually once a year or once in 2 years.
Okay.
To have a ultrasound scan or the tomography or the
And
mammogram.
even if she's of high risk.
If they are high risk, they should know, they should check their breast every month by themselves.
Yeah.
If they feel anything abnormal, immediately see the
Straight to
doctors.
the doctors.
So that is very important.
That's great. Thank you ever so much.
Thank
for that.
you.
Thank you.